Hi, my name is Dr. Ethan Hyde. I'm a licensed podiatrist here in Tennessee. I work for ankle and foot centers. I work at two primary offices here in Franklin, Tennessee, as well as Dixon, Tennessee. I grew up in Metro Detroit, just outside of there in a little town called Royal Oak. I went to Michigan State University for undergrad, go green. There I studied kinesiology, where I got my Bachelor of Science. I did all of my pre-medical classes. I did my podiatry school at Temple University in Philadelphia, go Owls. And now I've been living here in Nashville for about 3 years. I live here with my partner Katie. She and I love going outdoors, doing lots of hiking, exploring local breweries, and checking out new restaurants. Some of them, probably my favorite one is going to actually be NoCo, to answer your question. Maintaining good foot health, that's a good question. There's a lot that goes into that. I would say at the most basic level, it's going to be things that are going to relate to hygiene. So you're obviously making sure that you're keeping your feet clean, well moisturized, keeping your nails well manicured. I think that in anything, it's an investment, right? So it's an investment of time. It's an investment of making sure that you are investing into good shoes, not walking barefoot. And I think that pretty much most people benefit at least from some sort of an orthotic. Yes, so the most rewarding part of my job, it varies. It's day to day. It's always helpful, knowing that you've been able to make an impact in someone's life. that sounds, great on paper, right? But I think it's being able to give something back to someone. I think for a lot of reasons, injuries or through just, the weight of life, sometimes people, they lose mobility, they lose independence, they lose the ability to exercise or function or do things that make them happy. And I think being able to bring that back for people is definitely the most valuable thing that we do here. So currently I have privileges at multiple places. Here in Franklin, I usually do most of my surgeries out of the Brentwood Outpatient Surgical Center. I also have privileges over at Summit Main Hospital, as well as their Summit Outpatient Surgical Center, and then over at Horizon Medical Center over in Dixon. So in terms of, things that you really need to know about surgery, what I would say is that probably the single most important thing that it comes down to is making sure that you're in a position to be able to give it the time that it needs to repair. Obviously, if you have a fracture or it's an infection, sometimes surgery is necessary and you don't really have an option. But most of the cases and most of the surgeries that we do here in the foot and ankle space, really are elective. It's elective rear foot or reconstructive types of surgeries. So for the majority of, from my perspective, the single most important that comes in is making sure that you're in a position to be able to give it the time that it needs to recover. Not that you're trying to force it in because it fits your schedule or you have 2 weeks off because of Christmas break or whatever that might be. It's trying to make sure that you put yourself in the best possible position long term and not trading just one problem for another. So here at Ankle and Foot Centers, we always want to be able to be on the cutting edge of being able to bring the best possible equipment, the best possible technologies, the best possible techniques to our patients. And a big part of that is what we're trying to do from an in-office surgery standpoint. The hope is that we can make this more comfortable for our patients, probably a little bit quicker to be able to get things resolved for you. But part of that is that we have an actual C-arm that we keep here in our office. It allows us to be able to do things as simple as being able to get steroid-guided injections so that you can get it specifically into the joint where it can be targeted effectively to the spot in the area that you need it. It also allows us to be able to open up the playbook in terms of what kind of procedures and what types of offerings that we can provide here in the office. Our hope and our goal is over the next couple weeks to months that we're going to be able to provide some pretty complicated, minimally invasive surgery techniques, but with a really mom and pop type approach, being able to do it from within our own office.